Hello, good afternoon everyone. So last session we are discussing about gastro-retentive drug delivery system. So today's session we are going to discuss about naso-pulmonary drug delivery system. So first part of this section is about nasal drug delivery system, and second part we are going to discuss about pulmonary drug delivery system. So as the name is suggesting, so today's topic of our discussion is naso-pulmonary drug delivery system. So the name itself is a conjugate of two systems, nasal system and pulmonary system. So our drug has to be released in either of this system, naso or pulmonary. So what do you mean by naso and what do you mean by pulmonary? So the nasal drug delivery system is aimed at releasing the drug somewhere between the nasal vestibule, the nostrils, vestibule, to the nasopharynx. So whatever the region which is enclosed between these two areas, when the drug is released in between these two areas, it is called as nasal drug delivery system. So then what is pulmonary? So from nasopharynx, so this is naso. So from nasopharynx we have this larynx, we have this bronchi, bronchioles, all this upper respiratory tract and lower respiratory tract. So our drug, when it is released to either the URTI, upper respiratory tract, or LRTI, lower respiratory tract, such a drug delivery is called as pulmonary drug delivery system. So there we got a clarity between the nasal and pulmonary drug delivery system. So first part of our discussion is about nasal. So let's start with what do you mean by nasal drug delivery system. So first of all, let us ask a question. So why a nasal drug delivery system? Why not some other system? Answer is very simple. So there are certain drugs which will undergo first pass metabolism, or those drugs has to be intended for a local action. So there is this wonderful route called as injectable route. As we have seen in the previous sections, the injectable route, the bioavailability will be 100% bioavailable, but still it is not preferable for everyone. So there are some people who will avoid this injection simply because they are invasive, simply because they are painful. So in order to improve the patient compliance, so we have to search for an alternative route which has an equal amount of bioavailability or near or equal to this bioavailability, but still possesses the same advantages. How can you do that? You can do that by having this nasal drug delivery system. So it's not a better, not because it is better, just because it is having these advantages. What are they? So first thing is, it is safe, not like injection. Once it is given in an incorrect route, once it enters into the systemic circulation, it is very difficult to get or withdraw the drug from the body. We need hemodialysis. So drug withdrawal is very difficult, and the results will be instantaneously occurring in the body once you give it by an injection. So if it is a therapeutic effect, it's good, but if it is a poison or if it is given in an incorrect route of administration, it is going to harm the patient. So we'll have only span of minutes to save the patient. So hence we need to choose a safe route. So nasal route is a safer route, and there is no needle involved, there is no needle stick injury. So one of the problems of injectable drug delivery system is risk of transmission of bloodborne infections such as HIV or any other sexually transmitted disease. So these diseases can occur once the needle which is contaminated with an infected person is touched, or when it get contacted or punctures the skin of even healthcare workers. So the person who is administering, who is any other healthcare personnel, may also get affected. So we can avoid these disadvantages by using this safer, non-invasive nasal route of drug delivery. So there we got an introduction why your nasal drug delivery system is important, right? Now let us dig details and let us go into the details of this nasal drug delivery system. So let us first see what is naso. As I said, it is nasal drug delivery. So first of all, what is the naso? So somewhere your drug is released in this region from the nasal cavity to the nasopharynx. So this is your from point, source, and this is your destination, 2 point. So in between these two, somewhere in this area, if your drug is released, it is called as nasal drug delivery system. So the anatomy of the nose, it is consisting of a passage whose overall length is about 12 to 14 centimeters, and the nasal passage runs from nasal vestibule, that is from the nostrils to the nasopharynx, and your drug is having a narrow window of absorption in between these 2 points. It is nasal drug delivery system. So the lining, whatever the 12 to 14 centimeters of nasal epithelium, it is ciliated. So this cilia will help in filtering the dust, and it will drive the mucus in and out of the respiratory system. Whatever the dust particles accumulated in the nose, they were driven or they were protected by this ciliated epithelial lining, and it is highly vascular. It is very rich in blood vessels. So this provides a better absorption window for most of the drugs, and these are rich in mucus glands. Whatever the goblet cells are there which are secreting mucus, they are very rich or highly present in this mucus gland. So nasal secretions are secreted by goblet cells. So from where the mucus is getting secreted, it's the source, and the nasal glands, and the transudate from plasma. So we need to learn about this nasal secretions. Why? Because the drug or the vehicle which you are using for the preparation of nasal drug delivery, it should be incongruent. It is having a same pH of these of nasal secretions. It should be having a same or approximately same, and it should be having same isotonicity with that of nasal secretions. If there is any discrepancy, this is going to cause imbalance, or it may cause irritation, or it may be harmful to the mucosa, which is causing discomfort to the patient. So overall theme of this nasal drug delivery system is to prevent discomfort, improve the patient compliance. If that criteria is not achieved, we better go for a injectable system rather than going for a nasal drug delivery system. So it contains certain minerals, or these major extracellular cations and minor extracellular cations, anions, etc., like sodium, potassium, calcium, albumin, or even some enzymes. See, CYP450, which is actually present in liver, is also present in nasal mucosa. So hence there are certain drugs which will undergo rapid deterioration once they reach this nasal region. So the pH, whatever the of nasal secretions is there, it is in the range of 5.5 to 6.5 and 5 to 6.7 in case of infants. So it is slightly towards the acidic side. So there you got a basic idea that your drug which has to be released by nasal route has to be slightly acidic in nature. If not, it's not going to better absorb from the nasal cavity. Next slide, we are going to see the advantages. Some of the disadvantages we already covered, but let us see one more time. It offers a very large surface area. First important point is it has a high surface area, 14 centimeters of length, high amount of mucosa, nasal epithelium. All these things will provide a high surface area for absorption of the drugs. So rapid drug absorption via highly vascularized mucosa. So since it is rich in capillaries, blood vessels, it has a rapid amount of absorption instantaneously, almost instantaneously as that of injectable systems. Just like that, this can also serve as a rich supply of blood absorption. Next, it has a very rapid onset of action. So just like our injectable routes, this is also having very quick onset of action. So it has ease of administration and it is non-invasive. Most advantageously, this is the point which we need to highlight. So this is completely non-invasive. So even a non-compliant patient will feel comfortable by taking this nasal drug delivery system. So avoidance of the gastrointestinal tract, since we are giving the drug directly into the nasal route but not into the GIT route, so there are lesser chances of first pass metabolism. So the drug will not undergo first pass metabolism, extensive first pass metabolism. It has an improved bioavailability since it is not reaching the GIT. So most of the drug will get absorbed in this region. There is more improved bioavailability. So since there is an improved bioavailability, we can reduce the dose which is given to the patient. So lesser the dose, lesser the adverse effects, and more benefit to the patient. We can save the cost, time and money by incorporating lesser doses into the formulations, final formulations. We have improved convenience. So for having an injection, there should be a third person to administer the drug, but here there is no use of another person to have that a drug administered. The patient can directly administer the drug by himself without taking help of others. So it is providing a possibility for self administration. So these are all the advantages. So just like any other systems, this also has a flip side. So what are the disadvantages? The flip sides and disadvantages are the nasal cavity provides a smaller absorption. So I said it is having a high surface area, but compared to the GIT it is always low, because GIT is almost, the small intestine itself is 7 to 14 meters long, so which itself provides a higher surface area, but not as that of your nasal mucosa. So relatively inconvenient to patients when compared to oral delivery. See, some patients, especially who are having asthma or allergy, they feel difficulty when the drug is given by nasal route. So the drugs may drip from the nose, which causes discomfort to the patient. So this causes inconvenience in their ADL, activities of daily living. The histological toxicity of absorption enhancers. So if a drug is not having suitable absorption, we will incorporate absorption enhancers like DMSO, etc. So sometimes these can cause extra allergenicity or toxicity to the body, which causes again harm to the patient. So these are all some of the disadvantages of nasal drug delivery system. So what are the factors which you can alter or manipulate to have a better nasal drug delivery, or to achieve optimum amount of drug concentration? So let us go one by one. First is molecular weight. So usually higher the molecular weight, lesser will be the absorption. So that's what he says here. The nasal absorption decreases as the molecular weight increases. So this is inversely proportional to each other. So there is one researcher who proved it. So his name is Martin. He reported that there is a decline in drug absorption when the molecular weight goes beyond 100,000 Daltons. So usually that's why in the nasal drug delivery system we will choose molecular weight less than 500 Daltons. So even if it is 500 to 1000, we can use some other absorption enhancers to promote the absorption, but beyond 1000 it is practically difficult for a drug to get absorbed. So for a drug to get absorbed, there are actually two routes. One is the paracellular route, the other one is transcellular route. So especially drugs which are better absorbed, they'll get passed through any of these two routes. In order to pass through these two routes, it has to be small enough to pass through that miniature capillary is present in the body. So another factor is lipophilicity. Since our nasal secretions, they are consisting of mucus and other exudates, so if the drug is having lipophilicity, higher is the lipophilicity of the drug, better will be the absorption of the drug from this nasal drug delivery system. So that's what he says here. So he gave an example also. Hydrophilic metoprolol has lesser absorption when compared to lipophilic alpranolol or propranolol. So this proves that lipophilicity is directly proportional to absorption, unlike the molecular weight. So pH of the solution. So as I have said earlier, so it is slightly towards the acidic side. So acidic side drugs are more absorbed when compared to the basic drugs. So here is one example. Decanoic acid shows maximum absorption at pH 4.4. Beyond this, it causes decrease in the absorption. So this is because in the acidic side it will be absorbed, in the basic side it can't be absorbed. Drug concentration. Usually higher the concentration of the drug in the nasal route, higher will be the absorption, but it is up to a certain point. After the receptors are saturated, after that given mucosa is completely filled by the drug molecules, then it attains equilibrium and no longer drug absorption takes place. So what are the other factors? Pathway. So what pathway you are aiming to release the drug? So is it going to be a direct diffusion or active diffusion, passive diffusion, facilitated diffusion? All these things comes into play once the drugs need to get absorbed into the body. So enhancement of absorption. So not every drug is absorbed in a better way from the nasal drug delivery system. So we need to manipulate it. How we can manipulate? We can manipulate by using permeation enhancers. Examples of permeation enhancers are dimethyl sulfoxide or cyclodextrins, etc. These we alter the cellular permeability and promote better absorption. So following approaches. So first of all, let us see all the approaches. First one is absorption enhancers. Chemically we can use absorption enhancers, or physically, physiologically we can increase the residence time, or we can administer the drug in a particulate manner, by reducing the particle size in the form of microspheres, we can administer the drug such that its absorption gets increased. Or we can use a physiologically modifying system, so we can use prostaglandins or icosanoids, which will alter the nasal physiology and promotes the absorption of drug from the nasal drug delivery systems. So use of absorption enhancer. First approach is chemical approach by using absorption enhancers. Examples include cyclodextrins, as I have said earlier, and apart from that we can use surfactants or bile salts. So all these things will alter the epithelium properties and they promote the absorption of the drug. So they work by increasing the rate at which drug pass into the nasal mucosa. So they will alter or they will improve the permeation by increasing the transcellular pathways and paracellular pathways. So the mechanisms how we can increase the absorption are, they will either promote the solubility or they will decrease the mucosal viscosity. Once the disulfide bridges in the mucal membranes, mucosal exudates are decreased, their viscosity will be lowered. Once the viscosity is lowered, absorption will be increased. So we can also have decreased enzymatic degradation. So there are certain enzymes like CYP450 present in the nasal mucosa. If they are present, the absorption is going to decrease. So if I am going to reduce these enzymes, obviously the absorption is going to get increased. We can alter the enzyme kinetics and we can promote the drug absorption. So we can promote the paracellular transport or we can promote the transcellular transport. We can allow the drug to pass in between the cells or through the cells. Transcellular transport is through the cells, whereas paracellular transport is between the cells. We can promote the absorption of drug between the cells. So we can also go for another approach, that is increase in the residence time. If your drug stays in the nose for longer time, obviously its absorption is going to get increased. How you can allow the drug to stay? By increasing its viscosity. So what are the viscosity enhancing agents? Viscosity enhancing agents are high weight polymers, high molecular weight polymers such as mucoadhesive polymers like methyl cellulose, CMC, carboxymethyl cellulose, or polyacrylic acid. So these things have higher viscosities, hence they stay in the nose for longer period and they will allow the retention to allow the drug for longer period of absorption. Next, administration of drug in the form of microspheres. So lesser the particle size, obviously more will be the surface area. Whenever surface area is drastically increased, it also exponentially increases the absorption of drug from the body. So hence we can reduce the particle size. One such approach is preparation of microspheres. Once drug is miniaturized in the form of microspheres, it is going to better absorbed from the nasal mucosa. Examples include microspheres of albumin, microspheres of gelatin, dextran, starch, etc. So in these microspheres I will entrap the drug molecule from which the drug will be released into the nasal cavity. So use of physiological modifying agents. So our nasal mucosa is bound to some physiological mechanisms. So these mechanisms will control the ins and outs of the nasal cavity. So these are the agents which will control the ins and outs of the nasal cavity. So if we are going to interfere with these mechanisms, it is going to allow more permeation of the drug into the nasal cavity, thereby promotes the absorption of the drug. So what are the nasal drug delivery systems? Until now we have seen the advantages, disadvantages, approaches, and the drug modifying agents. So now let us see what are the systems available in the market. In the market we have a liquid or a powder formulation. So this formulation has to be released into the nasal cavity by using an appropriate device. So we are going to see such appropriate devices in the coming slides. So we can give them by using a pressurized or pump systems. We can use aerosols or we can use some spray systems to release the drug into the nasal cavity. So various drug delivery systems used for nasal drug delivery are, so first one is by liquid formulation. So we'll prepare a nasal drops. So there are availability of number of nasal drops, small squeeze bottles in which the formulation is present in a liquid state. So if you want to instill the drug, the face will be flexed in a backward position, supine position, and the drops are instilled into any one of the nostrils such that as directed by the physician. So it has an effect in the nasal cavity. Or we can have a squeezed bottle. So this is an example of squeezed bottle. The medicament will be present over here. So the manufacturer itself will provide a provision to provide the drug as a droplet into the nasal cavity. So these are squeezed bottles. We see more examples of squeezed bottles in the outside market. Or we can have a meter dose pump. So the problem with the squeeze bottles is there is no dose control. One patient, due to his higher pain, may take more dose of drug. Other patient, due to lesser pain, may take lesser dose of the drug. So due to this inconsistency, this may lead to patient variability. In order to prevent the variability, we can use a meter dose pump system. So that means irrespective of the pressure given by the patient, an equal amount of drug loads into this metered cavity, and whether you pull it hard or pull it slow, same amount of 1 ml amount or 2 ml amount only will be coming out of the drug. So this allows for the dose consistency and prevents overdose or underdose of the drug, and thereby prevents the adverse effects. So we can also have this optimum amount of deposition or optimum amount of drug delivery by using a particle size of more or less equal to 10 micrometers, because this allows for paracellular transport and transcellular transport. So we have a better absorption by passing the drug into each nostrils rather than a single nostril, such that drug will be equally calibrated in the nasal vestibule. So application. So what are the main advantages or uses of this nasal system? So these are organic based pharmaceuticals. So these will have extensive, any drug if it is having any pre-systemic metabolism such as progesterone, estradiol. So these things, no, they are steroids. Steroids have cyclopentanoperhydrophenanthrin ring, CPP ring. So if you see the structure of CPP ring, due to the large macromolecular structure, the drug will not be absorbed into the body. So in order to allow for the absorption, we have to choose an alternative route. One such alternative route is a nasal drug delivery system. So we can achieve, see in the market we have these contraceptives and other hormonal drugs which are given by nasal route, have equal effect as that of parenteral injections without pain and fuss. So the nasal delivery of peptide based drugs. So peptide drugs, if they are given by oral route, they are hydrolyzed in the stomach, because in the stomach we have proteolytic enzymes. All these enzymes are going to degrade the drug in the stomach. So hence we need to choose an alternative route. One such alternative route is nasal drug delivery system. So we can give this calcitonin or secretin, albumin, etc. All can be delivered. See, insulin for diabetic patients, always it is given by parenteral, but now there is a research to deliver insulin through nose, such that the patient feels comfortable to take the drug without causing any pain all throughout his life. So with that we concluded what is nasal drug delivery system. So in the next section, this will be our topic of discussion, that is pulmonary drug delivery system. So what is the difference between nasal and pulmonary, why we need to choose pulmonary drug delivery system, we are going to discuss in the next section. Thank you.